Hello, Dr. Joe here of the drjoe.com and the 2020from.com. So, as we speak, there are two prescription weight loss medications called Wegovy and Ozempic that are causing waves right now. So much so that demand has outstripped supply. Why is that? Well, it's because these two medications actually do work in terms of facilitating weight loss. And this is backed by research. In fact, you can expect to lose around about 15% of your body weight within 12 to 18 months of starting Wegovy or Ozempic. Now, are they as safe as they're being made to look? That's what we're going to be talking about in this video. So what you're going to get in this video is an overview of Wegovy and Ozempic. I'm going to talk about what they are, how they work, the benefits of using them, and more importantly, the side effects of using Wegovy and Ozempic. In particular, there is a side effect that I call the silent side effect that no one is talking about. You'll get to know about it in this very video presentation. So we've got a lot to get through. Before we do though, a quick plug. Here is my book on managing high blood pressure with lifestyle approach. Links to get a book right below this very video. So let's dive straight in. So let's have a look at the Wegovy and Ozempic side effects that are worth considering. Now, I always like to start with the positive. So I want us to look at how Wegovy and Ozempic work first of all, and the benefits before we move on to the side effects. So it's always nice to start off with good news, if you like. Remember, Wegovy and Ozempic are the same thing. It's just that you have a heavier dose of the semaglutide in Wegovy than you have in Ozempic. So I just want to point that out, that they mean the same thing. They have the same active ingredient in them, and it's important to know that. So how do they work? Well, Wegovy and Ozempic, they help the pancreas to produce more insulin, which means you have lower blood sugar levels. Okay, so that's good. The other way they work is that they suppress appetite, meaning you eat less often and you feel fuller faster. And this has been reported by a lot of the users. They actually feel fuller faster when they're eating. And the third way Wegovy and Ozempic works is that they slow down stomach emptying, which means you feel fuller for longer. And that means you eat less often as well. So this is how these two medications do their work. They perform their functions through these three mechanisms. Now, what's the benefit of Wegovy and Ozempic? Well, it means you'll have better diabetes control, because don't forget, Wegovy and Ozempic are actually anti-diabetic medications. That's what they are. And the second benefit is you lose weight. Now the question is, what weight are you losing? And this is the bit that concerns me. And this is the bit that I call the silent side effect that I'm going to be talking about in the later part of this very video. What weight are you losing? Okay, now let's move on to the side effects. We'll start off with the minor side effects, first of all, of Wegovy and Ozempic. What are they? Well, nausea and stomach upset. Okay, minor. Acid reflux, also minor. Constipation. Well, this could be major, and I'm going to talk about that in the later part of this video. But constipation is one of them because of the fact that the medications, they slow down gastric motility, gastric and intestinal motility, okay? So that could lead to constipation. Weirdly, some users have reported diarrhea as well. Now, the next minor side effect that you may want to consider is you've got to ask yourself the question, do you want Ozempic face? Okay, do you want Ozempic face? And what is that? Well, it means that you lose a lot of fat from your face and you now develop wrinkles. Do you want that? Well, that's a question that only you can answer. If you fancy taking a medication that makes you older than you actually are, well, welcome to Wegovy and Ozempic. The other thing that could occur with using Wegovy and Ozempic is insomnia. I put it as minor here, but it could be major as well because you need your sleep. Yes, you do. Now, let's move on to the major side effects. What are they? Well, inflammation of the pancreas is another. Okay, pancreatitis has been reported. It's not very frequent, but it has been reported. Now, another Ozempic side effect is thyroid tumors. This was seen in animal trials when the drug was being developed. So far, it's not been reported in humans, but something to watch out for in the long term. Well, I should say medium to long term, actually. So, thyroid tumors to look out for. Another major side effect is hypoglycemia, low blood sugar. That can also happen because, don't forget, these medications are anti-diabetic medications. They boost your insulin secretion, so you run the risk of having low blood sugar. Next major side effect is intestinal obstruction. This has been reported in studies from China. So far, it's a correlation. It's not been proven that the Ozempic or the Wegovy have caused the intestinal obstruction, but a correlation has been noticed in studies from China, something for you to also bear in mind. So, what else? Well, some other major side effects of Wegovy and Ozempic will include mental health issues. Don't forget, this medication is acting at the level of the brain as well, which means depression and anxiety can occur as a result of using Wegovy and Ozempic. Something for you to bear in mind. Now, moving on is another major side effect is your bank balance. Okay, now if you live in the UK, this is probably not a problem for you because Ozempic has now been approved by NICE, which means you're going to get it for free. But if you're living in a place like the US, your insurance company may not cover it, and if they don't, it's going to set you back by $1,400 a month. That's another mortgage, as far as I'm concerned. Can you afford it? And then the question will be, if you cannot afford it in the medium to long term, is there any point in starting the medication in the first place? Okay, that is a question that only you can answer, because if you cannot continue to afford the use of the medication in the medium to long term, this is what's going to happen. Weight regain. It will happen. All users have reported weight regain once they stopped using it. And in fact, research does show that the users who stopped using it, they regained 12% of the weight back and more within a year. So this is very, very important consideration for everyone who wishes to start Wegovy or Ozempic. Moving on, here is some quotes from some users who stopped using it. They couldn't afford to use it in the medium term. And this lady is a healthcare assistant. She said, "I'm very frustrated about the weight coming back on in so little time." Okay, so little time. I crave sweets, no longer feel satisfied with small meals, and I'm losing my energy as the weight comes back on. Okay, she seems to be saying here that she regained the weight very quickly. And here's another comment from a medical doctor who also used it. She said, "Discontinuing the medications does cause rebound weight gain, especially if I'm no longer following a routine of healthy eating and or moderate exercise." So this is an important consideration that you really have to remember. Next, a side effect, and this is one that really worries me, is that I call it the silent side effect of Wegovy and Ozempic. And what is that? Well, it is significant muscle loss. So you step on the scale and you're happy with the reading that you're seeing on the scale. But what are you losing? Is it just fat? Well, underneath that weight loss, you are actually losing muscle as well. Now, I'm not just plucking this out of thin air. This has been studied as well. Have I got any evidence for it? Well, here is a scientific evidence for you. And here it is. Here was a meta-analysis that was published in the Current Diabetes Reviews journal with the title "Effects of Anti-Diabetic Drugs on Muscle Mass in Type 2 Diabetes mellitus." And if we scroll down, I'm not going to take you through the entire paper. It's just that I want us to see the conclusions. Don't forget that Ozempic and Wegovy, they're actually anti-diabetic medications. That's what they are. It's just that the weight loss benefit is more or less a side effect that the drug company is now exploiting. So in the conclusion here,
it says that although semaglutide, which is Ozempic and Wegovy, dapagliflozin, long name, and canagliflozin have a large weight loss effect. Although they have a large weight loss effect, it is important to pay attention to muscle loss because of a decrease in fat-free mass that was observed in this very meta-analysis. So this is something that we cannot ignore. If you're losing lean body mass, you are losing a network of your metabolic machine, if you like. Now, is there something you can do about it? Of course there is.
And here is the solution. Weights. Okay? Weights. You have to use either free weights or your body weight. Either way, you have to push or pull something. You have to do resistance training, because if you don't, you're going to lose your lean body mass. And do remember that you did your muscle today, you did your muscles for tomorrow, and you did your muscles well into the future. You don't really want to lose them. Your lean body mass is very, very, very important, and you have to preserve it. Now, your next question is going to be, what should I do if I'm considering commencing Wegovy or Ozempic? Well, you've got to think about the risks versus the benefits. If you feel that the benefits outweigh the risks, then go ahead, start using it. But do remember, though, that we don't have any long-term studies on the effects of these two medications on the body. For instance, we know nothing about the cardiovascular side effects in, say, 5 years' time, 7 years' time, 8 years' time, 10 years' time. We don't have any studies on those. Are people going to develop thyroid problems well into the future? We don't know. So all these are some of the things that you have to consider. If you've got any family history of pancreatic problems or thyroid problems, I'll probably say stay away from using those medications. I would suggest you stick to lifestyle choices in managing your weight in those situations. So that's all I would say regarding a decision to start Wegovy or Ozempic. So hopefully you got some value from this very video. If you did, please give the video a thumbs up. Please like the video, and also please share this video with your friends, with your family, with your colleagues. If you got any questions regarding the content of this video presentation, go ahead, leave your comments or questions down below. Guess what? That's about it. Until next time, this is Dr. Joe signing out.